I don't respond, numb, to topical anesthetics. Can I get local nerve blocks instead? Is it possible to get a local nerve block for laser facial treatments? I've tried different strengths of topical numbing cream, and nothing works.
Thank you for your question. You submitted a question without a photo, and you state in your question that you don't respond to topical anesthetic, and is it possible to get nerve blocks for laser treatments? Well, I can certainly give you some guidance with this question. We have several lasers in our practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been performing lasers in my practice for over 20 years in Manhattan and Long Island, and certainly in our practice we have several different types of lasers, and basically the question you're asking, first of all, the answer is of course yes, but what you didn't specify in your question is what type of laser treatment you were getting. And let me explain a little bit about that. You see, when it comes to topical anesthetics, there are many different choices. We actually get a topical anesthetic that's custom formulated by a compounding pharmacy to work a little bit more effectively than what is currently generally commercially available. But that being said, that topical anesthetic can really be very helpful, but depending on the kind of laser treatment, it may not be adequate. So let's say, for example, you're having some type of resurfacing, or you're having, let's say, something at the most limited level, a micro peel. You might be more sensitive than someone who tolerates this with topical. I remember when after the CO2 laser, the first level of CO2 laser, the early erbium lasers came out in the mid to late 90s, and it was commonplace for colleagues to say that, especially if they were using the laser for a demonstration, that the patient can tolerate it. And I remember just putting a few spots of that laser and my patient being uncomfortable. So I decided, okay, well, we'll just treat this like we treat any other procedure, and we can give local anesthetic. So for a physician, performing local anesthetic is perfectly fine. Here's another example, and that's a more modern example. We have in our practice a Q-switch laser that we use for tattoo removal. And it is routine and standard practice to just use topical anesthetic for that laser. But because tattoo pigment is so deep in the skin, when the laser hits the tattoo pigment and the tattoo pigment literally explodes, well, that can be pretty uncomfortable. So I routinely give local anesthetic for that treatment. So it really, and there are other examples where, let's say, for example, you're undergoing laser hair removal. In our practice, the laser hair removal, one of the laser hair removal lasers we use is an ND-YAG laser. And when we do this laser hair removal treatment, we use a device that pours, well, essentially blows cool air onto the skin so that it cools the top layers of skin and has kind of an anesthetic effect, which makes the heat energy of the laser become less significant. So that's an example where you use cooling with air. When, for example, pulse light treatments, you can use a cold roller or cold on the skin to make the skin cold before you apply the pulse light. So again, the answer to the question is really yes, you can use a local block. There's only one situation where we don't use a local block, but it's really not indicated, is when we do non-surgical skin tightening and fat reduction using long-pulsed ND-YAG laser. This is the kind of situation where we want to hit a target temperature, and we actually want the patient to be able to tell us if the skin is getting too warm. The same applies to radiofrequency device like Pellevé when you're using radiofrequency to heat the skin. You actually don't want the person to be numb. You want the feedback, so if you go above a certain temperature, it's a kind of an intrinsic safety. But because it's what's called a long pulse, it actually, or I should say the heating is more gradual, it's actually more well tolerated. So I think that if you are uncomfortable where you are currently going for the laser, and if you are going to a place where it's where you're working, having the laser treatment done by an esthetician or someone who isn't licensed to do injections, they may be trying to dissuade you not to do that. I think you're better off now finding a physician and figuring out if maybe there's an alternative laser or other treatment, and if you need local anesthetic, by all means, go get the local anesthetic. So I hope that was helpful. I wish you the best of luck. Thank you for your question.